Good afternoon, everyone. Welcome to February office hours. This is Travis Bethel, and wanted to start off by just checking to see if everybody can hear me. If I could just get someone to confirm.
Hi, Travis. We can hear you.
All right, thanks, Christine. And the chat function, I've been just confirmed that folks can see my hello. And while we're doing that, I just wanted to remind folks that if you have questions throughout today's presentation, which will it's being recorded and will be put on our HI trainings webpage in the near future. But if you have questions throughout or discussion, please feel free to unmute or put a response into the chat box and we'll address that. But thank you as always, and we'll get started into today's presentation. So we're going to go over a policy procedure, talk a little bit about our redesignation process that the health home is preparing for, some NetSmart updates, and an OMH updates today as well. First, though, I wanted to welcome our newest CMA to our network, Lakeside House. They officially came on board on February 1st. So they're very new to our health home, and we want to welcome them. And for those of you who don't know, Lakeside House is out of Saranac Lake, New York, and they're a provider that's going to be providing service for adults in the North Country. So we look forward to working with Lakeside House. And again, welcome.
Thanks, Travis. We're all happy to be here.
All right, Mark. Great to hear you. Good.
Says email. No, if you are the
All right. So with that being said, I just thought I'd take some time to show our provider listing for the network. As you can see here, we have 23 organizations currently that are listed that are active providers. We have 3, as you can see on the bottom right-hand side, that are in process of onboarding. So we have executed contracts that we're working with St. Joseph Psychiatric Center, White House, and People USA to become providers within our network. So they're working through those steps currently, those 3 organizations. So we'll be soon to add 3 more once they finalize that process. And then you can see here as well the color coding as far as organizations, whether they provide adult.
You have to sign in. That's because that's how I got in.
We have to mute ourselves if we're I don't know if everybody knew.
Correct.
If somebody's unmuted. So we have that color coding there to show what population that particular organization serves and supports. Again, we're excited. We're growing as a network, and we have a great number of different types of providers, which makes us a stronger network as well, because we can specialize in many different aspects of the health home work that we do in supporting people. So kudos to the network for all the good work that we do and will continue to do. Any questions so far just about network in general before we get further into today's discussion? Okay. Then we're going to touch on policy and procedure. I was going to turn it over to Jessica to go through what we just sent out a whole slew of policies, as you saw in the last week or so, but we wanted to take some time today to do more specific discussion around them in case there were more questions or clarifications that folks wanted to have. Jessica?
Hear me?
Barely.
All right, I'll try to talk really loud. If something happens, can you take over?
Yes, we can hear you loud now.
Okay, thank you. I can't call in, it's blocking me, but WebEx, I love it. Can you hear me?
Yes.
Good, great. So first we had an update to our billing policy that was for an annual update. There was one slight change in this policy. Basically, we just removed outreach activities and we added those as an appendix to the policy rather than having it right in the middle of the policy. And that was really just because outreach is no longer billable. but we still wanted to keep the information in there. For our cans policy, it was an annual review. There was no changes, but just a reminder to make sure that everyone is pulling those aggregate reports in the UAS. You really want to make sure that all of your cans are signed and finalized once they're done, as well as your level of care determinations. If you do not sign and finalize those assessments, you will not be able to bill, and if there is too much of a time lapse, you will have to redo them. The next two policies, care transitions and continuity of care, annual changes or annual updates, no changes. The one thing we did do was add a hospital code desk guide. And this was to help us when we get those HICSNY alerts in NetSmart. The hospital does not come in with the hospital name. If there was an admission or an ER visit, it comes in with a code, and sometimes it's not clear what that code means as far as what hospital it's tied to. So we did get a list from HICSNY and we put it in those two policies. So if you do have an ER alert or an admission, you can find out where your member is. The next policy that was updated was our disenrollment policy. This was actually revised due to a state update. The end reason codes have been updated to reflect members stepping down from health home and to an alternate level of care. So if it's a PCMH program step down, or if it's a step down to care management through their MCO. Then the attachments on page 19 and 20 have been updated to reflect those changes, just because some of our end regions have changed. So the attachments also had to change as well. Our next policy is our HARP oversight policy. This policy had some pretty significant updates, and that's due to the HARP workflow change. About half of the services that were once HARP services are now core services. So you want to make sure that you read through this entire policy, just because there are a lot of changes to the HARP workflow. And now there is the additional workflow for core if someone would like to pursue core services. Our incident reporting policy was updated to reflect a better IRAMS form. Previously, our policy had our incident reporting form in it. However, that form did not exactly match the IRAM system. So if you are going to complete this form and then submit it to somebody, we wanted to make sure that all of the information reflected what needed to be put in the IRAM system exactly. And lastly is our quality assurance policy. This had the most significant changes out of our policy, so please read the entire policy. It has been updated to reflect our updated quality process. It is going to reflect our ability to run more reports to monitor quality rather than relying on manual audits to do so. So there's that. And we've also updated some of the frequencies at which we're going to audit certain things due to the fact that we can now run reports and quickly look at some stuff. So we don't have to do those long manual audits anymore. So if you could read that policy in its entirety. And then upcoming policies, we will have our annual review of our comprehensive assessment policy, and that will be due next month. So that will be coming out sometime in March. Does anyone have any questions on any of these policies or any of the changes?
All right. Well, thank you, Jessica. If there are any questions, feel free to reach out as always, and we will respond. I just noticed that improvement, it does not say quality and assurance improvement. So my person with the question was leaning over the NT on that. So I apologize for that typo, that error. But the other thing I wanted to point out for the instant reporting, I sent that template out, or I should say the Health Home sent that template out for folks to utilize moving forward. We're going to be putting that on the website and pulling out the existing IRMS form that's on there as well. So that will change. We do have an outside entity that does our website upgrade, so there can be a little bit of a delay at times. So just bear with us as that stuff gets put on there, but it is in process. So that will be coming soon. Right, so we're going to move on. So redesignation, I touched on this last month. Just want to let you all know tomorrow's our D-Day to get our entrance packet in. And what that's really been at this point is a self-audit of our program, and at which once we submit, the state's going to look at what we rated ourselves as, basically, as far as our policy implementation to the network. Are we including within that policy implementation all the requirements that we're supposed to be including? Our quality management program, what types of trainings do we offer? What types of quality tools do we offer, not only as a health home, but to support the network providers as a whole? So there's been a lot of work done to pull all that information together in recent weeks, and we're getting ready to finalize that and get that sent in tomorrow by close of business. Part of that process is also a survey component. So we have to send in all of the contacts for each of the CMAs, which would be the supervisory contacts. You will likely be reached out to by the state, and they'll be asking for a survey, and basically, talking about how you feel we are as a support to you as a provider in a network, and are we responsive? Are we thorough? Are we timely in our responses, et cetera? So that'll be coming, and that's valuable information to have as well as we continue to move forward to support you all. So that'll be part of that. And then there's also a chart review. So part of this process is going to be looking at a sample of charts, which we will not know that sample till just before a couple days out from the actual audit. They'll be here starting on the 7th of March. So as soon as we know those names across the organizations, we'll get that to folks. But we encourage strongly that you're doing those self audits now. Just not only to just do it thoroughly for your own organization, but also to just in preparation in the event there were to be a chart selected from your organization. And then once all that's done, this whole audit's going to be virtual. Once that's all completed, we'll get a response back. We'll have some checkpoints throughout that week of March 7th. I think we have 4 different meetings with the state throughout that week on various points that they're auditing. And then we wait until we get the response. So I thank you all for everything you've been doing, as far as the self audits and for all the great work that you always do. And we'll keep you posted as this progresses. Any questions around the redesignation process that anybody might have, or any comments? If not, please reach out if you think of something after the fact. So that is coming very, very shortly. The next thing I wanted to touch on was just the NetSmart reports. Last month we talked about NetSmart is looking to, by the end of Q1, change that report self-service component. After some more discussion, they're actually looking at during Q2 at this point, so they pushed it out, which we thought was a good thing. And we're hoping that you feel the same, because I know a lot of you in your organization utilize that self-server report function. One of the things NetSmart has really stated is they're not going to take everybody's report that they submit and turn that into a template. They're going to take like trends of certain types. So if there's a number of certain types of reports that seem to be consistent across the board, then they would make a template out of that. So we want to encourage folks, if you have something that you value that's in the system that you're using, to forward that information to Taylor Dawson, who will be that conduit to NetSmart for consideration. And we want to make sure that you're putting the title of that particular report in the email as well when you do so. So a little more time on that, which is a good thing again, because it seemed to be that was going to happen quickly. But just so you know, though, they are intending on changing that reporting process. I did see a question in regards to the redesignation. Will agencies get a list of what clients will be audited like in the past? Yeah, as soon as we know, Raquel, once we get those names, we'll definitely let your organization know if you are one that's selected, or for any organization for that matter that's selected. We'll get that out to folks. But again, I think last time, I wasn't here when that last audit occurred, but my understanding is it was like 3 days out that they sent that list. So it was a very small window. So, just any preparation you can do now, walking up to that, would probably be beneficial, because that window is so small when they do send that list. Any questions about anything up to this point? I know we just went back to a redesignation question, but anything on reports, around that report self-serve function? Okay. The next thing I wanted to touch on, when people go into documents and they go to the attachments to upload an attachment, I've got on the left side of the screen here a category drop down. Right now in production, there's nothing in that drop down. So we are in process, we have it in UAT currently, of developing a template, which is on the right hand side, of the number of different types of forms that would be categorized, so that when you're updating attachments, we can have more consistency. If they're 5055s or 5058s, 5200s, if it's a health home serving children withdrawal of consent, it's all a consistent flow as far as titling and whatnot, and uniformity. So we've been working on that. It's just about ready to switch over, but we wanted to take some time to bring that up to the group today, see if there's any questions or thoughts around this. We feel it's going to be beneficial, but at the same token, it'd be good to hear what you all think as well, before we do turn it on. Any thoughts on a quick look at this as you're just hearing this, if you think this would be beneficial for folks?
Hi, Travis. It's Jessica.
Hi,
Casey.
Jessica.
Hi, I think this is a great idea and I really like this. I think it's going to be helpful for staff. Do you know if it's going to have any impact on the current attachments? Or will the category just be blank for any current attachments?
I don't think we've looked that far into it yet, Jessica. That's a great question. I don't think if it's going to address anything that's current, but I don't want to say that solid yet until we've looked at it. I think it would be as we move forward. But let's check back with you on that, though.
Thank you.
Yep. Any other thoughts on it or questions? See, helpful, save time, absolutely. Good, cool. So we're on the right track with it. Good. So we'll circle back on that one question. That's a good one. So for any existing docs, if it's going to address that or not.
All right, Travis.
Yes.
I'm pretty sure that any current document in the system will continue to appear as is.
Okay.
And then you will only be able to use this category drop down for new documents that you're uploading into the system.
All right. Thanks, Jessica. We have also a meeting coming up in the coming week with NetSmart, so we can ask it just to hear them say it as well. And then you're probably right on, Jess, I'm sure. But for the network's sake, we want to just circle around on it as well too with NetSmart. All right, cool. Anything else around the actual categories tab? All right. And then there's another thing that NetSmart's working on. They've yet to turn it on. It's in the test environment, but they want to look at custom forms and updating those forms to make them more user-friendly. more streamlined, more modern feel, if you will. I think that was the word that we had heard. So I wanted to show you just some things they're working on the actual comprehensive assessment for us. First thing is the appearance of what it would look like. So when you get on that landing page, when you're opening up a new assessment, this is a screenshot of what they're looking at versus what we currently would have. So it's going to have, you know, a slightly different look to it when you get on there. The next thing is going to be the navigation itself. So currently there's like a drop down that shows the different pages of forms. That will no longer be when the time comes when they go live with this. They're just going to be going to, you have the ability to click at the top of the screen to scroll through to go to the different form that you're looking to go to. And then they're going to move the draft final selection to the top of the screen above the navigation. So that's another change that they're looking at. The other thing too, I failed to mention, was that the other intent of this is to make the form quicker. So as they make these changes and they put it into production, so that it's not so slow and draggy and laggy. So they're trying to do things that'll help speed it up. So when people are in there doing their work, it's not taking, you know, forever and a day to get something done. Validation errors. So an immediate thing here is if you don't fill out a field with an asterisk, it's not going to let you go on. So that's going to be a quick thing to make sure that people are filling, so that you get that notification. The other thing with validation errors, when you go to save and you run into any errors when saving, it's going to pop up. You'll see like this example here where it goes through the demographics piece. It's going to tell you what is not filled out. You'll have an ability to go right to that particular question within the form that wasn't filled out to fill it out, so that you're getting that immediately. So you're not kind of going back and looking when there's an issue. So those are the things around NetSmart that they're looking to do that assessment. So we're working with them currently to look at making sure that form's working properly in UAT environment. You know, that it's testing through, everything's working the way it should. And then once it comes around, we'll let everybody know before that go live, just so you have a heads up that that's coming. Before I came off that slide, I should have asked, is there any questions around or thoughts around these changes with the comp assessment that are being proposed? Okay. All right, so more to come with that. This is just a shot I had sent out to the network a couple weeks back now, the extension of the regulatory waiver through OMH. Commissioner Sullivan had signed off for an additional 120 days. So what does that mean for us? You know, it goes back to our face-to-face visits for our Health Plus members. OMH is really encouraging, as we're well aware, to do those when possible, the face-to-face, as long as it's appropriate. It's not a health or safety issue. It's not COVID related. So there should be really an assessment, a risk benefit determination that's done. If it's going to be an audio or a telephonic interaction, that will be able to be billed at the Health Home Plus rate, as long as all other factors are met for billing for Health Home Plus. But we got to make sure that there's documentation in the electronic health record and the person's chart of that determination to what led to that not being face to face. So just want to make sure folks continue to do that. And I'm hoping that this extension is the last one and things continue to improve. But for the time being, we still have that face to face waiver in the event that we need it for Health Home Plus folks. Any questions around that? Thoughts, concerns? Okay. All right. So telehealth. Last month we talked about telehealth, and folks were asking, well, what does that mean? So we've been doing some digging on that, and OMH just finalized part of their emergency ruling. It's got to come out through an official memorandum still, but able to get a hold of the emergency regulations. I provided a link here at the top. There is the ability to have just audio only visits now. So that is a change. So what does that mean outside of face-to-face? So if it's, not the classic in-person visit, you can have a virtual or an audio, which would in this case be telephonic for us. That is allowable. And it's also supported as you go further in that document on page 16 for billing purposes. So at this point, we're given that clear indication that telehealth would also mean telephonic when it comes to completing those HCBS assessments, the eligibility assessments. That was where the question originated last month, specific to folks who wanted that eligibility assessment to happen for HCBS. So I just wanted to circle back on that because we had a couple people ask on it. Sorry it took a little bit, but we were digging, trying to figure it out. Anybody have any questions or thoughts around this particular ruling? I think it's a good thing. We finally saw something in writing on it because there was a while where there was nothing. But if you have a chance, check that link out, go through that part 596 and see how it's laid out. Is this for HARP as well as the question? This would be specific to telehealth, period. So HARP would be specific to the health and recovery plan. So you got anybody with telephonic, we can do that audio with. Does that answer? Okay. Any other questions around that? Okay. And then just our staffing changes. I know that we've had some changes that the network was made aware of recently. So this is our team as it stands today for the health home. So if you need anything ever, please reach out as you always do, and we will be in touch and get back to you as soon as we can. Health home email is always the best way if you can, just to make sure you can get to one of us in the event someone's off or not available. The health home email is monitored throughout the day, each business day. That would be the best bet for somebody to get to one of us. And that's all I had today, unless anybody else had anything they want to talk about or any questions.
Hey Travis, it's Sarah. I just had a thought, I guess I'm gonna throw out there.
Yeah.
So I know for me, it's just so hard. We're so busy doing so many different things. And I just wonder the policies that get updated. I know we usually end up having extra time set aside that we don't always use. And I don't know if other people think it would be helpful. I know the way that I learn, I think sometimes it would be helpful if we actually went over the policy, when we went over. I know you guys go over kind of what the update is, but just kind of actually go over the policy itself. It helps to burn in my memory that way. I don't know if that would be helpful to other people or not.
So to pull it up and walk through it while we're on the office hours, is that what I'm hearing?
Yeah, if there's extra time to do that, that would be helpful for me.
Okay. Other thoughts on that? Is this something that people find beneficial? All right, we're getting some responses. Yes, please. Yes. Okay. Well, we're starting to get representation across a number of organizations, so we can incorporate time for that. It's going to be ebbs and flows, as you all know. I mean, there's some months that there may not be any. There's other months where, like we just had, where there was a whole slew of them. So we'll try and carve time out for as appropriate for each of those updates. Thanks, Sarah. That was a good suggestion.
Thank you.
Anything else anybody want to talk about?
Travis, this is Mary.
Hi, Mary.
Hi, is it possible that the PHQ-9 could be within the comp assessment instead of having it in another tab?
I don't know the answer to that offhand. Jessica, do you know that one offhand? I know you have to go and have it linked over. I just don't know if it can be embedded in there though.
I'm sure it could be. I don't know if NetSmart would change that for us. I actually recently requested a couple of updates to the comprehensive assessment. But I was asking them to do those updates for free real quick. I don't know if they would do that for us right now, or if it would be a bigger deal to go in and put that in there. We have a meeting with them, I believe tomorrow, Travis, right? To go over the comp
Yes. Yep.
updates. I can ask them, we can ask them on that call if they can put it in there, but the updates that I did ask them for originally, they said they couldn't do while they were moving our current comp to a different architecture, that they had to wait until once it was moved. And then on the back end, they could make those changes for me. So if it can be done, it won't be done with the new look of the comp. It would have to wait, but we can ask tomorrow.
Okay, I was just curious because we had to put a separate audit question just to make sure
Yeah.
nobody was missing it. So, and the other question, what happened with the substance abuse question? Or did anything happen with it where you're forced to answer that they had 1, 2, 3 drinks, even if it's 0?
Yeah, that question we have to bring that to NetSmart still, to be honest with you,
Okay.
Mary. That got slipped through. Sorry about that.
Okay, now I was
Have
just
to
curious.
update that entire assessment because that tool is a standardized tool. We can't change the questions and or responses to that specific tool in that section. So we would have to look at another risk tool to use in lieu of that tool that exists in there now. So that's us looking into something else, an alternative, and then updating our comp to reflect that. So that's something we can talk to NetSmart about. But again, that would be another significant ask of them, and we would have to research which screening risk tool we're going to use in lieu of the one that's in there right now.
Okay, thank you.
Yeah, and it's, you know, it's like, since it's a custom form in the system, I mean, changes that have any significance obviously are going to be something that they're going to want to look at from a monetary component. So we just have to weigh out, you know, what that means. And then there's also that build out time that Jessica is referring to, that it's always, you know, later than sooner. So, but we'll definitely ask the question, Mary, and we'll see. Well, the two questions, the substance abuse one and then the PHQ-9, and we'll just see what they say. And then we can bring that feedback to the group just as far as, you know, what that may mean and if it is worth looking into at this point. Thank you. Is there any other thoughts or questions? All right. Well, as always, thank you for everything you do. And I hope you all have a great rest of your day. And we'll get this recording out on the website in the near future. Thanks again, everybody.